Hello and welcome to the Medtronic Diabetes online information event with guest speakers Dr Mark Forbes and Medtronic pumper Sally Rees-Jones. My name's Aviva Castle, I'm the Marketing Manager for Medtronic Diabetes and I'm looking forward to guiding you through this evening. So how this evening is going to run is I'm going to introduce our guest speakers, and we have a number of questions that have already been sent through from yourselves to ask Dr Mark Forbes and Sally Rees-Jones. If you have any questions throughout the evening, you can feel free to tweet us at hashtag T1DPump. That's T, the number 1, D, pump. You can also follow us on Facebook and Twitter. So I'm going to start out by introducing our guest speakers. Dr Mark Forbes is Staff Specialist General Medicine and Endocrinology and Clinical Director of General Medicine Gold Coast Health Service District. Having trained in South Africa and the UK, Dr Mark Forbes has worked on the Gold Coast since 2000 and is now based at Robina Hospital. His clinical interests include insulin pumps, acute medical admissions, general endocrinology, young adult diabetes and complex type 2 diabetes management. He's actively involved in all levels of medical education and is a clinical sub-dean at the Faculty of Health Sciences and Medicine, Bond University. Our other guest speaker this evening is Sally Rees-Jones. Sally was diagnosed with type 1 diabetes at the age of 10. She's been using a Medtronic insulin pump for 8 years and is a prominent and well-known interior architect. Sally has completed mountain treks including Mount Everest Base Camp and Mount Kilimanjaro in 2013. She's raised significant funds for Juvenile Diabetes Research Foundation and strives to encourage people with type 1 diabetes to aim for better control so they can achieve their dreams. So I have a list of questions that have been sent through in advance, and I'm going to throw out to Sally and Mark to answer these questions for us. So our first question is to Sally from James in Orange. He asks, how did you react when you first found out you had type 1 diabetes?
Well, James, I was 10 when I was diagnosed, and I was a child who was terrified of needles. So, to be honest, the main thing I was worried about was the needles. It didn't really occur to me that the diabetes would mean I couldn't do anything, but all I was just terrified was that, you know, in 2 hours' time I had to have an injection. And I think for a little while after I came out of hospital I was scared of having hypo. But I think it was probably most hard on my mum because I couldn't do my own injections for about a year. My mum had to come to my primary school to inject me, and I know that she was quite worried about, you know, me having hypos in the middle of the night when, you know, she couldn't look out for me. That was probably the main thing.
Thanks, Sally. And the second question from Jennifer from Victoria and Hayley from Queensland. They've asked, how did you find out about insulin pumps, and did you have any concerns? What actually convinced you to go ahead?
Well, the idea of the pump was first introduced to me by my educator when I was about 20. I had quite erratic blood sugars that would spike high and low a lot. I did a lot of exercise and I travelled, and my educator could see that a pump would really help me with these issues and, you know, help with flexibility. I can't say at first I was very receptive to the idea. I was a little bit freaked out by, you know, being attached to something all the time and the infusion set. But actually my grandfather passed away from type 2 related complications, and that kind of made me think, well, if I can use this technology now to get my blood sugars more stable, that, you know, it's going to help me avoid these complications later down the track. So that was really what made me decide to go on it in the end.
Thanks, Sally. So let's get Mark's perspective now. A question for Mark. What would you say about pump therapy to people who are newly diagnosed with type 1?
So I think it's important to realize that there's an awful lot to type 1 diabetes, as Sally's already kind of highlighted. There's so much information that we try and give you as patients when you first come into contact with the service, and a lot of that can be quite overwhelming. Pumps, at the end of the day, are another way to deliver insulin, and all type 1s are going to need insulin in one form or another. My personal practice is I will often come to pumps as an insulin delivery after we've got some other basics around food types and what insulin does and why you need it. And often patients will start on needles even if for a short time, and then we'll come back to a pump if that's appropriate. I predominantly see adult patients. I know that amongst pediatric populations and younger patients, a lot of those patients these days are actually started on the pump immediately from diagnosis, and that can have some advantages as well. but most adults that I see have been diabetic for a while, and we bring the pump in later. So it's important to realize, I think, that the pump is, as I've said, just another way of delivering insulin. It's important to understand that it's not about, from my perspective, putting the pump on and forgetting about your diabetes. If anything, you need to be more aware of what's going on around you so you can make the appropriate adjustments to the pump and bolus at the right times, and we can set the settings up the way that we think will help. And then it really needs to be a team effort between your healthcare team and yourself as the patients, or as carers if you're caring for young people or people with diabetes, and deciding what's best for you. And the pump is certainly a good option for a lot of patients.
Thanks for that, Mark. Another question for you from Karen from Western Australia. What can you do on a pump that you can't do when using injections?
The advantage of a pump over injections is more about you're able to deliver small amounts of insulin and vary the amount of insulin that you're taking at any one time. The biggest advantage and how we see that manifest in terms of better control is that you get less variability of your blood sugar. Sometimes the needles can end up with you having quite variable sugars which swing from higher to lower levels. And Sally has already told us that she's experienced that. It's also, I think, there's less of an issue with low sugars with hypoglycemia on a pump for most patients. There's nothing that a pump can't do that needles can. In fact, it's usually the other way around. I would say there's things that the needles are more of a disadvantage rather than the pumping more of a disadvantage for most patients. You've got to accept the fact that you have to wear this pump the vast majority of your day, although you can certainly take it off for a couple of hours at a time as needed, and you can have holidays from the pump if you're going to go to the beach for a day or something like that. But that's one aspect of it that you certainly need to think about, that it is going to be with you all the time. But other than that, whatever you can do with a pump, you can do with needles. Needles just limits you with the variability sometimes, but not all patients have that issue.
Thanks, Mark. Now back to Sally from Jadine of Croydon, South Victoria. Does a pump get in the way of everyday life?
No, actually not at all, and definitely much less than you would imagine. This was one of the things that held me back from going on it for ages, because I thought it would be quite annoying, and it turned out really not to be an issue at all. I actually asked a girl at an information night who was about my age on a pump, you know, what do you do with it when you're sleeping, and does it get caught on things, and, you know, where do you put it, and just having a chat to her and seeing, you know, how she really thought it was quite easy was one of the things that helped me go on the pump. You know, you can stick it in your pocket. I actually keep it under the middle of my bra. Yeah, it's not as annoying as you think it might be. The first time I put in the infusion set, I was a bit nervous about it, but literally after that, it probably took me only about a week to get used to it. And now you know, it's just part of me. I guess it's like, you know, having your phone in your pocket. It's just another thing. There's some activities that it can be a little bit annoying for. Like Mark mentioned, you can disconnect it for, you know, an hour or two at a time, and it's not really an issue. I play hockey, and sometimes when I'm running around a lot, I find that it does slip out of where I've got it, so I'll just take it off. It's really not a problem. If you want to go for a swim, just take it off. Just remember to put it back on. But yeah, no, much less than you think it will. Doesn't get in the way.
Great, thanks, Sally. Another question for you from Rodney and Michelle in New South Wales. What has been, or has there been any challenges in using an insulin pump for you?
A bit like what Mark was saying. I mean, there's challenges whether you're on injections or a pump. I don't find it too challenging in general, but I think the challenge is just to get back to basics and remember that you can get really, really good control with the pump, but you just have to remember that the more information you input into it, the better it's going to be. So, you know, remembering to type in the grams of carbs you're eating, and the more accurately you can do that, you know, the better control you're going to get. So really just, you know, in your busy everyday life, remembering to be diligent with it. But it's not really any different to, you know, being diligent with, you know, remembering to have your injection or remembering to test your blood. But yeah, just remembering that the more you put in it, the more you're going to benefit from it. So that's a challenge, I guess, just to, you know, remember to keep up with all the information you can put into it.
Sure, that makes a lot of sense. Thanks, Sally. These next two questions for Mark are related, but we'll start with the one from Matthew from Queensland. Can an insulin pump help you control your blood glucose and HbA1c?
So Matthew, I think there's probably two ways to answer that. In my clinic and with my patients, I would definitely say yes, that the average patient has a significant improvement in HbA1c and their overall blood sugar control. Often that's because they've had great difficulty doing it because there's been so much variability in their blood glucose levels that when we've tried to increase the insulin to get the HbA1c down or the average glucose down, we end up causing too much hypoglycemia, so they've been limited by that. And if we can eliminate that variability, as I've said, then we can usually improve overall control. When you look at scientific papers and published articles around HbA1c reduction, there's quite a lot of argument in the amongst my colleagues and amongst us endocrinologists around how much improvement you can get. But even in the most vigorous trials, there's at least about between 0.6 and 1% HbA1c reduction. And that's as good as any other treatment for diabetes. And often we see a lot more than that if we get it right and if you do all the necessary steps, as we've already highlighted tonight.
That's great. Thanks, Mark. And another question from Jadine of Croydon South in Victoria, rather. Can an insulin pump measure your glucose levels too?
So the insulin pump itself doesn't measure your glucose levels, but there are various ways now that we can measure glucose. The most common still is finger prick glucose levels or capillary glucose levels or blood sugar levels that often get referred to, and that's the traditional finger prick that most people are used to, measured on a meter. You can enter those in manually, or these days, certainly on the Medtronic pump, you can have them automatically beamed into your pump if you're using the right kind of meter. What you can do as well now is have something called a continuous glucose monitoring system, or CGMS. If you buy the Medtronic version of that, it can automatically send your glucose levels into your pump, and those then get recorded. You still need to do some finger prick glucose a couple of times a day to make sure that that's an accurate reading. But as the technology expands and improves, the pump is able to adjust itself to some extent, particularly when you're going low, if you're wearing this CGMS all the time. So in summary, the pump itself doesn't measure it, but there are various devices available now that enable the blood glucose to automatically be recorded by the pump. And we can the pump then uses that to calculate insulin, or we use it to help us calculate insulin, and we can get the information out afterwards when we download it.
Great, thanks, Mark. That makes a lot of sense. So, Sally, another question for you, talking about when you see someone like Mark. The question from Anna from New South Wales is, has having a pump made a difference when you see your healthcare team?
Yes, definitely. It makes it, I think Mark will probably agree, it makes it easier when you see your healthcare team. When you're on injections, you have to manually write down, what you've been eating and how much you've injected and how many grams of carbs and what activities you've been doing. But with the pump, because it's an electronic device, they can actually upload that into a computer program, and it overlays graphs of, what your blood sugars have been when you've entered them in, and how many grams of carbs you've been bolusing for. So you can see trends in the software, which, they can say, oh, you seem to be going high here every day, and you don't actually have to remember to write this down every day because it's just stored in the device. So yeah, seeing those trends makes it much easier to kind of pinpoint where in the day maybe you need to adjust your insulin levels up or down. And I do use the CGMS, and because that sends to your pump, I think it's about every 2 minutes what your blood sugars are, you can get a really accurate graph of what your blood's doing, even overnight when you're sleeping. So you can be a lot more accurate with your control, I think. So yeah, it's definitely helpful when you see your doctor and they can just plug it all into their computer and see what's happening.
Great, thanks, Sally. And now a question from Renee from New South Wales. Renee would like to know, how do you manage pumping with building endurance?
So I think Renee's probably talking about training for maybe the 2 treks I did, which were, one was an 8-day trek and one was a 21-day trek where you were walking for 8 hours a day, which you generally would not do. Like any training, it's a bit of trial and error involved, but with the pumps you can put in temporary rates of insulin delivery. So what I did was start out with a few hours walking and see how your body reacted, because everybody's different. And I found personally my blood would go low at the start and then would go up a bit after the first hour. So then I would adjust my pump so that it gave me a bit less insulin in the first hour and then a bit more kind of after that. And I just worked for the months before I went away on these trips with the endurance training on setting different rates in the pump depending on what point I was at, you know, in my exercise. And it's different for every person, which is why the pump's really good, because you can adjust it to suit you. You can put temporary kind of settings in there that you say, okay, I'm going out for a 3-hour walk. I'll put this rate in for that amount of time. You know, say 30% of my usual rate I know is going to work for me for prolonged exercise. And also the CGMS, it has kind of thresholds you can put into the pump, like a low number and a high number. So the pump will set an alarm off if you're going low or if you're going high, so you can kind of catch your blood sugars before they either get too low or too high and you have a problem. So it's really helpful for that. And it means you don't have to be testing your blood, you know, every 20 minutes. You can just have a look at your pump with the graph from the CGMS and see whether it's going up or down or whether it's steady. So it's really helpful.
That's great, and pretty impressive climbing Kilimanjaro, Mount Everest base camp as well, I have to say. Okay, so a few questions for Mark about life changes and long-term effects. The first is, do hormone changes like having your period influence insulin levels?
Absolutely, and I think that's probably under-recognized quite a lot. I think any kind of hormonal swing, be that your periods or your menstrual cycle, be that pregnancy, be it a stress response to an emotional event or a physical illness or surgery of some kind, that's all controlled by various hormones in our body, and they all will affect your blood glucose level in one way or another. The challenge is that's usually variable from person to person, and if we're talking about menstrual cycle, some women will have effects just prior to their period, some during, some after. Some will go hypo, some will go hyperglycemic. In other words, their sugars will go down or their sugars will go up. And it's really a matter of working out what happens usually to a patient and adjusting accordingly. You can set rates on the pump to allow for that, and people can, you know, I've got some patients who need a lot more insulin leading into their period, and in fact that's their signal, if you will, for their period about to start, that they know their sugars suddenly go off and they need more insulin to get there. It affects women in different ways, but it's definitely an effect and something that you should allow for if it's a significant issue.
Great, thanks, Mark. Next question from Rodney Burns of New South Wales. He asks, what's your view of the long-term complications of type 1 diabetes using a pump?
So I guess what this is asking Rodney is can we have an effect on long-term complications? Well, if you extrapolate and you realize that we can control complications and prevent or at least slow down complications by having good glycemic control and good sugar control generally, and I've already said tonight that I think you can improve your control on a pump. You therefore should slow down any complications that you may have already prior to going on the pump if you're unfortunate enough to be in that position, or delay the onset or stop them altogether if you maintain good control for a long time. I mean, I've got patients under my care who have come in with some fairly minor complications which have pretty much stopped and nothing's progressed, which is great news for them, but also patients seem to go for a long time with good control and therefore much fewer complications. We know that if we keep sugars tightly controlled, your risk of complications, while slightly greater than a non-diabetic person, is not all that much higher. So it's definitely the pump, if you can achieve control with it, will improve your risk of complications.
Thanks, Mark. And a question, what would you say about the pump to women with type 1 diabetes who are pregnant or wanting to start a family?
There's lots of experience now with both pregnant women using a pump and people thinking about family planning and sort of preconception care with pump. We know that having good control leading into a pregnancy is an ideal situation to be in, and having bad control is really not very good in terms of baby growth and formation early in the stage of pregnancy. We also know that if you have poor control through a pregnancy, there's potential complications because baby can often grow bigger, and that can lead to all kinds of challenges around birth time and complications for both mum and baby. So anything that improves your control leading into that is a good thing. The advantage, I think, of the pump is similar to the other advantages in that you can get really tight insulin control and variable levels through a day and through the pregnancy as a whole. If you couple the pump to a continuous glucose monitor, as we've discussed already, you can then have some confidence around avoiding even more low sugars or hypoglycemia, because the controls that we set, the sugar levels we set during pregnancy, are in fact tighter than we set for people who are not pregnant. And therefore your risk of having low sugars is a little bit higher. If you've got that CGMS, you protect yourself against that even further. And a lot of patients really enjoy that safety net, if you will, of having the CGMS hooked up to their pump during their pregnancy.
Great, thanks, Mark. A question for Sally from Sarah in Victoria. If you had to choose one benefit of the pump, what would it be?
I definitely think just the flexibility. You're not locked into what you're doing by, the last injection you had or your long-acting insulin from the night before. For example, I said I'm quite active. If you suddenly decide you want to go out for a run, you don't have to think, oh, well, I only just had my injection with breakfast and now I'm going to have a juice or something so I can go and do exercise. You can simply turn down the rate of insulin on your pump to suit what you want to do. Yeah, the flexibility, it just makes everything so much easier. I have my own business and no 2 days for me are the same, so I can, some days I might be sitting at my desk all day and other days I might be out running around on building sites, and I can turn my insulin rate down if I'm more active or put it at its normal rate if I'm less active. Yeah, the flexibility for sure. It's much better than, well, I find the flexibility better for me than when I was on injections. I have a lot less hypos, as Mark said.
That's good to hear. Thanks, Sally. A couple of final questions for you, Mark. The first is from Cherie King of Mount Molloy in Queensland. And Cherie wants to know, what do you think are the future developments with the pump?
Oh, I think, the technology is moving all the time, and every time we have a new addition or a new release of a pump, there's some technological advancement. What we're ideally working towards is what we call a closed-loop system, or I guess an artificial pancreas, where you have a device that measures glucose, sends those readings into the pump, and the pump is then able to adjust your insulin appropriately according to your glucose levels. While we're not there yet, as I said, we're trying to move towards that. What we have got to already, certainly on the Medtronic device, is that if you're wearing a continuous glucose monitor and a pump at the same time, and your glucose drops below a certain level, the pump will automatically switch off, and you can preset that level. The pump will switch off insulin delivery for up to 2 hours unless you choose to override it or wake up and choose to override it. And this prevents a lot of the severe hypoglycemia that we were seeing if people were wearing the technology. We also know fairly conclusively now that that does not result in very high sugars a couple of hours later. And in fact, sugars return to pretty much normal. And then you can adjust the pump setting as are appropriate. You can obviously override that feature at any time so you don't have to have the full 2 hours to spend. We know also that on future technology we're potentially going to get to a position where not only can it switch it off, but it can begin slowing down the insulin delivery as your sugars are dropping at a very steep rate. So that's kind of the next step on. We've not yet got to the point, certainly in the commercially available way, where you can increase insulin for when the sugars go higher. But there's lots of research going on, both in a research lab setting, in hospital settings, and hopefully in the not too distant future in home settings, where there's a fully automated system where your CGMS sends information to your pump and to a computer, which then has a mathematical formula plugged into it which will adjust your insulin appropriately. The preliminary results of this data are really encouraging, and hopefully not too far away before that sort of stuff is more widely available. There's also other technological advances with CGMS, and the gadgetry gets more accurate and easier to wear and more sort of easier to use and all that. So all those developments are happening along in the background as well. It's not just about the mathematical formula of the insulin delivery.
Great, thanks Mark. It's good to know there's such exciting things in the future, but also that there's some great advancements that are here available today. Our last question for you for this evening is from Renee De Beer from Cherrybrook in New South Wales. Renee would like to know, where can I find an endocrinologist who is knowledgeable about using insulin pumps?
Well, I guess perhaps a disadvantage. I'm not sure if there's any one single site or one single list you can go to. In most areas now, pumps are becoming more and more common and more popular amongst diabetics, and certainly in most centres, GPs or endocrinologists who don't do pumps will know someone who does, and they will refer you appropriately. The other option, of course, is speaking to other patients, and I know that I get a lot of patient referrals by word of mouth through other patients, where they'll get themselves referred in to see me if they know that I'm doing it, and I know that's true for other endocrinologists around the country. The GPs can probably also contact insulin pump companies, and they'll normally have a fairly good idea of who in the area has prescribed pumps in the past. So I guess it's a networking decision rather than a single list or a single source of truth. It does seem uncanny to us healthcare workers how much you guys network as patients, and that's probably a big source of advice and one that I'd encourage you to keep using.
Great, thanks Mark. Okay, well, we're going to get some final thoughts from both Sally and Mark, but while we do that, we do still have Twitter open, so if you have any further questions, you can tweet us at #T1DPump, that's T the number 1 D pump, and we'll be monitoring those and seeing if there's any further questions coming through. We also have our Twitter handle and our Facebook site available for you to follow and answer questions. While we're doing that, I'm going to pass over to Sally just to share some final thoughts.
I guess my main thing is that if you're thinking about trying a pump, just give it a go. I mean, I was always told that if I didn't like it, I could go off it, but I've never once even thought about going back to injections. And I know lots of other diabetics who I've met through various things who are also on pumps and say they would never go back either. It's nowhere near as bad as you think it might be, or as annoying or painful or anything like that. So, I mean, and really just collect information about it, like just, you know, listening to things like this, or seeing if you can chat to other people wearing them to ask, you know, sorts of questions that doctors can't maybe answer. Weird questions like, what do you do about it at night? Does it, you know, does it get stuck around door handles? You know, weird things that, you know, other people can say, oh yeah, you know, sometimes it does that, but it's not very bad, you know. Yeah, just collect information and give it a go. I mean, it's been really good for me. I used to have a lot of hypos, and I probably only have about 10% of the amount of hypos I used to have, if any. Yeah, I mean, it's definitely been an improvement in my life. I wouldn't say my diabetes is perfect, but I know I can get it a lot closer than I probably could have on injections, so it works for me. Yeah.
Thanks, Sally. And Dr. Mark Forbes, if we can get some final thoughts from you as well.
I guess the thought that kind of resonates with me a lot, and one that kind of drives me to continue working with pumps and working with patients on pumps is something that a patient said to me who'd had diabetes for 40 years before we put him on a pump. And his response, having dropped his HbA1c by about 1.5% and having no hypoglycemia, was that he'd wished the technology was available earlier in his career of diabetes. But that, as Sally has said, this wasn't a hard thing to do. You've got to wrap your head around the fact that you're wearing this thing all the time. And he said it was a bit of a headspace adjustment for him, but much better for his diabetes. And that's been kind of the overwhelming response I've had from patients. Even if they have to put up with wearing it, and it's not that much of a big deal, their diabetes and their health is much better, and they feel far more in control than they did. And I guess, while I acknowledge the pumps won't be for everybody, and I will never push a pump on somebody who doesn't want it, it has to be the patient's choice. I think it's the best way we have currently of delivering insulin on current technology, and I think it's the closest we can get to a normal functioning human pancreas. And that's hard to ignore.
Great, thanks, Mark. We actually have had a question come through for you from Ruth. Ruth says her daughter struggles with type 1 diabetes and dieting. What are some best practices when trying to maintain a healthy weight?
I think we can sometimes tend to get a bit complex in our dietary advice. And I think the same should be true for diabetics as it is for any other non-diabetic person, that if you have a healthy diet with fruit and veg and protein of some kind, whether it's meat or another protein, you're not going to go too far wrong. I think dieting fads, while they may have a role in terms of weight loss temporarily, are quite difficult to maintain. And swings in weight are challenging in terms of our health. And challenging in terms of our psychological well-being, because we think we're losing weight and then we put it all back on when we stop the diet. So I think if you can achieve sensible, healthy eating that's sustainable, in other words, if you want to go to a slightly lower carbohydrate content, if you're that way inclined, go for it. But it's almost impossible to go on no carbs forever. So something that you can maintain and still enjoy your food is an important thing. The other thing to say is that we have the ability with pumps and with needles, if they're done in the right way, to control your sugar pretty much regardless of what you eat. The problem with that is that if you're eating high-fat, high-calorie, high-sugar foods and giving yourself enough insulin to control your glucose, you're going to get overweight real quick without too much hassle. So it's not so much about what you eat from a sugar control point of view. It's more about what you eat in terms of staying healthy and maintaining a healthy weight, because obviously being overweight has got far more impact on your health than just your diabetes. I hope that answers the question.
That's great. Thanks, Mark. Okay, well, I think that's all the questions that we have live here on the site. If you have any more, feel free to still tweet them and we will answer them offline, and we'll also be posting this video live as well. But I just wanted to thank you all once again for joining this online information event, and also to our speakers, Dr. Mark Forbes and Sally Rees-Jones, for volunteering their time tonight. We really appreciate it. If you have any further questions, please head to our website, www.t1dpump, that's T, the number 1D, pump.com.au, or contact us on 1-800-777-808. That's 1-800-777-808. Thanks very much for your time tonight, all. Goodbye.